All right, welcome to the Friday's edition of John McEntyre Show Live. Prime time. I'm John McEntyre. With me laughing here, I have Andrea, and we when you see Andrea, on Fridays we're covering Medicare, right?
Yes.
But before we actually get into it, we just wanted to make sure and let everyone know that people that were affected by Hurricane Helene, they're in our thoughts and prayers.
Absolutely.
Because it was actually, really, they were really affected by the damage up there, uh, which is our hometown. Well, we're in Charlotte. We live in Charlotte, North Carolina, from Florida up, but an area of North Carolina. Let me make sure and clarify it, because a lot of people, 26 deaths behind this hurricane. It was a fast moving hurricane, but it did a lot of damage in a short amount of time. And even up here in North Carolina, especially, here, we lost a lot of power. In North Carolina, over 1 million without power. They've gotten it down to around 800,000, and it is going down. But now we're preparing for the flooding, things like that, because flooding comes later.
Yes. So there's the flooding of the areas that were not hit as bad, but then there's the initial flooding, Tennessee, Western North Carolina, the Asheville, Black Mountain, Chimney Rock, Lake Lord, that the foothills area of North Carolina. They experienced a lot of what everyone else experienced, but with the dam there was a lot of swelling. There's a lot of small windy roads, and there's a lot of washout, and many people are trapped. So we're praying for everyone, and we hope that those who haven't heard from your loved ones, continue to pray. We're praying with you as well, and hopefully it's a situation of maybe they're at a shelter and just waiting for their devices to power up.
Yeah, because seriously, like down here in where we live, just west of Charlotte, there in the Charlotte Metro, they're actually using the old middle school as a shelter. So this is serious. These people had to evacuate. They forced some evacuations of some of the areas because there's some major dams in the area, and they had to open them up to keep really keep it from doing damage in particular areas. And so those people are actually at quick thrown up shelters,
Emergency centers,
emergency shelters,
true emergency centers.
True emergency centers, places that hadn't been used in a while. Now they're actually emergency shelters and stuff like that. So but I'm watching on the news and watching videos people are sending. It's like Lake Lure, for instance, which is your hometown, home area. Places that we would go on Sundays to eat, things like that. Our favorite coffee shops and all of this, just like completely gone. I mean, these places haven't looked like that since they were first built, first founded, like almost 200 years ago, over 100 some odd years ago. And it's like you can't see the roads anymore. It's like the road was just being cut through, and it is just crazy at how this thing done. I mean, I'm still a little bit shaken by that. And then you get up into Asheville; those rivers have swollen and flooded, and tractor trailer, the trailers floating down the roads, and Highway 40, parts of Highway 40 collapsing and things like that. And I'm like, wow, this is a couple of years of damage done.
Absolutely. Absolutely. So we're highly recommending everyone to stay safe. Call before you go, because many times you think, oh, nobody's going to answer the phone. Well, they may not answer the phone or update their Facebook or social pages because power is out, and they're working on other priorities. So just keep everyone in your thoughts and prayers. You stay safe, and use more wiser judgment.
Yeah, exactly.
Before traveling out.
All right. So let's get into this here. And before we do that, we gave the Helene update, which brought something else to mind. I talked about it a little bit yesterday, of preparing for Helene. Um, making sure you had certain documents, insurance. In America, there's 6.1 million uninsured homeowners. That adds up to $1.6 trillion in uninsured homes. And so those are, and in these particular areas that were, hit hard by Helene, there's a lot of those homes are in those areas. So there are a lot of uninsured people there, homes. So homes are damaged and gone. If they don't have the cash to replace it, they're pretty much homeless. They've lost everything. And so that's a startling statistic. That's almost 7% of the population is uninsured. Home population is uninsured. Yeah, that's serious. That's some serious stuff.
$1.6 trillion.
$1.6 trillion in uninsured homes in America. In America, the word is America. Uninsured, and it's for different reasons. So that's just something to really think about. Something to really, really think about. All right. So today we'll be talking about basically the Medicare. We're getting ready for the Medicare Annual Enrollment Period, Election Period. Some people call it the Fall Open Period. But it's basically for enrollment of those with Medicare Advantage plans and drug plans, the prescription drug plans. This is what the open enrollment is for. People that are already in Medicare Advantage plans, drug plans. They can make those changes this time of the year. We're going to cover some of the some of the things we haven't covered, some of the questions that have been asked, misconceptions about it. But before we get into it, we have a big wallet win as far as Medicare go, and it was a mom was facing a $300,000 bill for surgery that Medicare had denied because of coding issues. Even though the surgery was medically necessary, it did not meet specific guidelines. We filed an appeal, and in the end, the appeal came back in our favor, and we were able to insure the client that we were insured that we owed nothing.
That's a major win.
Yeah, that's a major win. $30,000. Yeah.
It goes back to what we've said the last few weeks is it's best that you double check. Make sure that you're double checking everything. And just because you were initially denied, or maybe the referral or something that you received, it wasn't approved, it doesn't hurt to try again. And they're listening to everyone, the beneficiaries, and so ask for help. Get some assistance if you've been denied, or you're wondering if your medications or something like that may not be approved or what have you. Try again.
That's right. Like we said, we talked about it last Friday and also the Friday before. If you're denied, that doesn't make it permanent.
Right.
Something can happen. When there's humans involved, there may be errors. And so most the people that are against Medicare Advantage plans, they just make them seem like they're like the worst thing in the world, that almost all requests are denied, things like that. But that's not true. That's not true at all. It's a small percentage that are actually denied, and then out of that, around almost, especially not only Medicare Advantage but also Medicare, that they just like to deny things, which is not true. And it's has almost upwards close to 80% of reversal.
Yes, I'm glad you brought that up, because it's bringing everything that you hear is not always true, and everyone's situation is not the same. So just because someone else had some frustration or some issues with their policy or with a procedure or something like that, doesn't mean that that's going to apply to you. And if you're denied or information is requested, just ask questions.
Yeah.
And I understand there's a lot going on and there may be some things that people don't understand, but just take a breath and don't quit before you begin. Just ask more questions. Can you help me understand why this was denied? Or can you help me understand why I need to take, help me know why I'm taking the steps that I'm taking? Because sometimes you're asked to take extra steps so you can get approved, so you can get what you need.
Right. That's right. So there you go. That is a big wallet win. $30,000 taken care of, because that, I'm quite sure that could have been stressful. That will stress anyone, especially a beneficiary, and they're probably on fixed income, things like that. And so $30,000 is a big hurt, because one thing that is going on, the actual number of bankruptcies in that age group, they're climbing.
Oh, wow.
And
Okay.
that's the reason, is because of healthcare,
Yes.
the cost of healthcare. So taking care of that, $30,000, you don't have this back wiped out off of you. It's a big burden off of you, your family, and everyone. So that is a big win. All right, so let's get into today's topic. We were talking about the actual annual enrollment period, and we just wanted to, make sure and touch on some things that we haven't, because thinking about the Medicare enrollment annual election period for, the beneficiaries, it can be a headache, and most of them, they just don't want to, just deal with it. But it is your health care, so it actually is something you have to bite the bullet and really just get to work on. And the sooner you take care of it, and get it behind you, you'll be ready for the next year, because what you're doing during the annual enrollment period from October the 15th to December the 7th, you're choosing your plan, Medicare Advantage or prescription drug plan for 2025. This year is 2025, which goes in effect January the 1st.
John, I wanted to mention something to hopefully bring a lot of people that put their mind at ease, and that is you change every single year, and so your health may improve or it may slightly change, or it could have some changes. Maybe there's a little bit more complication or trouble getting here and there. So you don't stay the same every year. So some of the needs that you have don't stay the same. So
That's right.
I'm bringing this up because I'm hoping people realize that this is set up to help you look to see what I have, has it been working for me, and if I need to make any changes. The great news is you're not stuck. You can make updates.
Right. So these plans, they're 1 year at a time. They're not like Medigap. And so every year, if you've chosen a Medicare Advantage plan, this is something to come up. You may not need to change, but this is the time, if you have to change for a certain group of beneficiaries in Medicare Advantage, this is the time to actually take care of it. So, because we have to think of some of the reasons that people may change. For instance, you don't like the plan changes coming up for the next year.
Yes.
You should have, maybe by September the 30th, you should have, it's mailed out. It should be mailed out by then, the annual notice of changes from your Medicare Advantage carrier, from the company that's providing the plan. You should have received that, or they mail it out by then, because you can't choose your plan, make the choice until October the 15th anyway. So they have a certain amount of time there to mail it out. You should receive it by the 15th, go through it to see if any changes are going to be in your if there's going to be changes in your favor or out of favor for you. So you want to make sure those changes aren't going to happen. Some people change because of premiums.
Yes, the cost has went up, or the cost may stay the same. Most companies, you will see some type of change because of inflation. And there's some changes that are greater than others, and that may be the reason for the change.
Yeah. Another reason to look is because you may learn that one or more of your doctors may not be in network. They may decide that they won't be accepted. Well, they're going out of network, or maybe the plan has decided that they're switching doctor networks or whatever, and they're going to make the change. That's very important to some people. They want their specialists, they like their primary care physician, and they don't want to change. So this could be a reason to look at your plan to make sure that that change will not be happening.
I'm glad you mentioned that. Another one to also look to see if the hospitals that you've been going to make sure that they're also still in network.
Mm-hmm.
So there's the in network, there's the out of network, and then some of them may have what they call tiers. So maybe your doctor is on tier 1 or tier 2, and you can check to see maybe your doctor is in network, and it's a few miles away from where you live. So maybe drive a few extra miles just so you can stay at a lower cost.
Yeah.
So
Yeah,
those
it'd
are
be
just
something just to look, make sure they're in network. The plan, your prescription drug plan, may be dropping one of your important medications for next year. That's a big one because that medication cost is it's what my mom used to say. That's a peach. It's a real peach. Sometimes those drug costs increase, and that's a reason. So you want to make sure, because for instance, let's see, someone had been informed that in their particular drug plan that their medication was moving from tier 6 to tier 5, and that was meaning that there was going to be an increase in price,
okay.
and a significant, because it was a lot of their medications. So that was a significant increase for them, which was a reason to look at a different prescription drug plan.
Right, right. Because you can have that separate drug plan, and then there's some plans that you may have that may have some things built into it. So you may want to look at everything and not just one, but absolutely take a look at your drugs and make sure. And if you don't know how to look that up, you can call, or you can even call us. But they will look up all of your medications and let you know, yes, this is still at the same cost, or it will be costing more. So those are things you can look into.
Right. So, and some people actually use this period of time, if they're healthy, and it may be a different situation, they may want more comprehensive coverage of a Medigap plan, of a supplemental plan. And so this is a good time to look at it. If you don't meet certain criteria, you're going to have to medically qualify for it. And they're going to ask you a lot of questions. I mean, a lot of questions. But it doesn't hurt to actually try. Now, I wouldn't jump the gun and just drop my Medicare Advantage plan before I know if I'm going to qualify.
I'm glad that you mentioned that, because just like you're looking to do some comparisons to see if the plan that you're already on, if it's worth staying, you can make phone calls now to your Medigap company, though, and to see, okay, what do you have that would be comparable? And then the next step is, I'd like to see what it takes to see if I qualify. Don't just not apply just because you have to go through medical underwriting, because yes, you'll have to answer a lot of questions, but so what if you're able to get more benefits,
more comprehensive coverage?
Yes,
that's exactly right. And so that's why I say you don't just drop your Medicare Advantage plan, because it stays in effect until the end of the year. So, and the Medigap plan wouldn't go into effect to the first of the year. So that's why I don't want to make any rash movements and call and drop it saying, hey, I'm dropping this, I'm going over to a Medigap plan, and just stop paying or something like that. Make sure, you have things lined up before you do it.
That's absolutely right. Make sure they're lined up. So you've got this coverage through the end of the year, and you've got from October 15th to December 7th. So you've got a window of time that you can do some research on the existing plans. You can reach out to the Medigap plans, and you can use this time to weigh your options before, and then decide before the 7th of December, do I want to stay or do I want to make a change? So it's not a once and done. You have to make the decision on the 15th. You can call back and make other changes and say, I want to change it to this, but you just have to do it before those time periods end.
That's right. Right. Within that time period. So we covered a lot, and we was talking about the annual letter, and all of this. the annual notice of change is huge. It's a big thing. When it comes in the mail, it looks like the old Sears catalog. But don't let that freak you out, because the cover letter, the letter is on the top, is what it's going to tell you if there will be any changes.
It's a real, what I like to look at it is the summary.
Yeah, it's the
So it's the
actual
Cliff
summary.
Notes.
It's the Cliff Notes. It's the actual summary. So if there are going to be any changes, it will be there. Now you can actually look in to see exactly how they will be taking effect, but it will tell you if anything is going to be increasing, if medications aren't going to be covered by the drug plan that's included, things like that. If the doctors are leaving network, everything, whatever pertains to you, you have to just know that it's going to be on the cover letter. You won't have to read the entire thing to to the entire notice to know if you're going to keep the plan alive. So that's what I wanted to say before we move on to actually give some pointers on how to prepare for this particular situation. Biggest thing is make a list of your medications.
Absolutely.
Make a list. If your prescriptions have changed since last year, then you will want to reevaluate whether the current drug plan is going to work for you. And that could cause you, like we said earlier, that could cause you to maybe change plans to a different plan that give you more bang for your buck.
Absolutely.
Yeah. So make sure you just have them listed. Best thing is list them on paper. Most hospital networks now, they're online. They have a list of your prescription drugs. Log into your account, pull up your your prescription drug list. Like I did with my dad, he had a couple of updates. Some of the medications he's come off, he doesn't have to take them any longer, which was a good thing. He's not having to increase anything. It's just that the way that he's taking some of them have changed. He's taking them, but he takes them a different way now. Things like that, and a couple of them he no longer has to take. So we went in. It was updated by the hospital, but I went in to make sure that it was correct. I sat down, I looked at looked at each bottle, make sure everything was like it was supposed to be. And because that's going to be important. This next, he hasn't received his annual,
annual
notice of change. And so once he received that, then I'll take a look at that. Then we'll go from there. So just make sure those prescription drugs are usually, the most important part. That's why, you want to look at your prescription drugs first. We talked about the Medigap part. If you wanted to make that change, we did discuss that. What else was there before with those particular changes?
Well,
health conditions. You mentioned health conditions. Which brought up the next point. The next question that we received is, can you change Medigap plans during the AEP? We sort of touched on it, but I wanted to make sure and pull it out and set it up by itself, because that question is asked a lot.
Yes, absolutely. And the main thing before you make any decision about changing from a Medigap to a Medicare Advantage plan, or if you are looking at vice versa, is to just make sure that you do a proper comparison. So you're really understanding, if I make this change, what does that really impact? How does that really impact me?
That's right. Because Medigap, they don't change benefits, but they do increase premiums.
Yes.
Some people are getting sticker shock behind that. That's why a lot of people, I think some like panic and maybe jump ship a little too quickly before actually looking at the entire financial situation. That's what we've helped people with. Like, really let's look at your situation, and then they say, "Oh, okay, well, I don't have to do it. I'm fine. I just need to rearrange some things." Most people, they just see the premium increase and they panic. Whereas they just look and rearrange money, move some things around, move the budget around some, and they're good. But most of them, they panic. Don't panic. You have plenty of time, like Andrea said earlier. you have plenty of time to look at this. So you get the notification today. Don't make the changes today.
No, just read through
You
it, and
have
then
till December the 7th.
yes, so read through it, see what you see on the summary, what's changing, and that's your guide to know to go to those particular pages. And then if it doesn't make sense to you or you've got some
Mhm.
questions, pick up the phone and call.
Yeah.
They've got employees there that will explain different things to you. And don't tell them that you're looking to make a change. Just say, I want to make sure I understand. I'm calling to get clarify or calling to make sure I understand. And then when you're calling on the other side, just let them know I'm doing a comparison because I want to see how this compares to what I have right now.
Mm-hmm.
I know I'm paying more for it, but what does that mean on this side?
Right. That's right.
Mm-hmm.
So there you go. That's as clear as we can get it. As clear as we can get it. Another question is, do you have to enroll in Medicare each year? No. Once you enroll in Medicare, you're in Medicare. You have to, now you can disenroll, like for instance, from Plan B or whatever, for whatever obvious reasons. But this time of the year is specifically for Medicare Advantage or Part D, which is prescription drug plans only. That's what it's for. You're in Medicare. Another one, do you have to renew your Medicare supplement every year? No, you carry that year to year.
Yeah.
And you may even carry it if you change states. You may even carry it. You can take it. Anywhere, any doctor that takes Medicare will take a supplement plan.
And when we say supplement, it's interchangeable.
Medigap and Medicare supplement. Yeah. Mm-hmm. Now, if, say, for instance, you move from New York to North Carolina, you still have Plan G. You can take it with you. Maybe a different cost in the other state. Yes. So you make sure you want to check that. That's what it says. That's the only thing you just want to keep up with the Medicare supplement Medigap plan. That's usually the only change you're going to see.
That and potentially your premium cost.
Yeah, that's what I'm saying. The premium cost will change. So, are there any penalties if I fail to do anything during the annual enrollment period? And that pertains to the Medicare Advantage or the prescription drug plan.
Yes, there's penalties.
Well, there's not penalties.
No.
If you're in a plan, there
mm-hmm.
are no penalties. They will just assume that's what you're going to keep, and so January 1st, you will just stay in the same plan that you're in.
Yes. So the penalty is you may stay in a plan that you don't like. Mm-hmm. You may have changes that surprise you. So really the penalty is not doing a little bit of homework.
Yeah.
And
that's
we've all have a little bit of time in our busy days between now and December 7th that we could take the time to read through, call and ask for help. If you like researching online, you can even look at the information online. So they will just automatically keep you enrolled in the same plan. You'll just miss the opportunity that you could make changes.
That's right. So that does it pretty much for today. I know we've loaded up a lot of information in a 30-minute period, which before we go, that leads us to the actual question of the day. And the question of the day is, question of the evening, something to think about for the weekend, is have you received and read your plan's annual notice of change for 2025? That's the question of the day. Have you received it? They have until the 30th. So today is 27, 28, 29. Monday should be mailed out by Monday. You should be receiving it sometime next week. And that gives you a week, over almost 2 weeks, to understand where you are with your plan, if there's going to be any changes that would affect you. So.
And then you have between October 15th through December 7th for you to make some changes if you need to your Medicare Advantage plans or your drug plans.
Yep. All right. So, if you don't have anything else, I think we've given them enough for the evening, for the weekend to think about. So, for those out there that, if we provided value, we ask that you subscribe to the channel, that you like it, that you share it, that you tell others about it. If you have any questions about your plan, you need someone to look at it, you need some assistance with it, contact information is there on the screen. You can call us Uh, we can talk virtually or in person. It's you make the decision. And like I say, Audrey, if you don't have anything, we'll close it there. Right.
Stay safe.
All right. So everyone out there, we'll see you Monday, same time, same channel. Good evening.